Hi, I'm Charlotte Jensen, and I'm an animal-assisted speech therapist. And I wanted to take a few minutes to talk about how I incorporate my therapy dogs to calm children who are anxious or resistant. I have found that this has been the biggest game changer for my practice, working with kids that have a variety of special needs. Anxiety is such a common thread among my kids, especially those that have autism and sensory processing differences, that being able to have the therapy dogs help me out with this has been really helpful. And before we actually look at some videos and photographs of how the therapy dogs help me, I'd like to really thank my families for allowing me to use these videos for educating others. Most of my families have seen such a big difference that the animal assisted therapy can bring to their child, and they've been very generous in allowing me to share with others. So some of the ways that I have the therapy dogs help me on a daily basis are having them there as a supportive presence, incorporating calming breath routines, having them help me with some deep pressure input, and then also being able to draw attention to them to just interrupt some escalating behaviors that might be happening. I have to laugh because my dog Bodhi is here in the background and he's suckling on his blanket as he's getting ready to fall asleep. He suckles like a baby. So if you're wondering what that weird movement is in the background of my video, that's my Bodhi. So the first benefit that I noted when I was bringing my dogs to work is that they can just be a supportive presence for the child. In this case, the dogs are not expected to do any one particular thing, but just by being in the room, they are able to bring the anxiety levels down, help kids calm, and then persist through difficult challenges that they might be facing. Let's look at how supportive presence looks with this middle schooler. I've got two videos of him. He is working on some reading things in these videos. And the first one over here is actually in hyperspeed. So just watch for how many times he just naturally reaches out to pet her when he's starting to feel frustrated. And just also watch her response as well. You'll notice she's not on a leash and she's not getting treats or anything like that. She is just there. Delta happens to be my more empathic speech therapy dog. She really seems to sense when kids need her right there up close. Not all of the therapy dogs that I worked with have been like that. Some have other strengths that they bring to the table. But just watch her reaction to, as well when he seems to need her presence. And then let's see how that looks in a little bit longer format. One thing that he really struggled with was when he would reach a word that he didn't know how to read very well. Instead of being able to stay calm and use his strategies to figure it out, he tended to just kind of immediately get a bad attitude about it and want to quit or avoid persisting. And so having Deltas present there made a big difference for him. So let's see how that looks. Okay. Nice. I guess let's move on to our fur, or do you want to try the tricky one? The count steps.
Offer, leafer, good fur, leafer, hot fur, rinse.
Nice. Oh, you're doing
Leafer, differ, comfort, deeper, effort.
Let's just skip ahead to the last line, the trickier one. So we've got the pen. If we find other prefixes or suffixes, others. Yeah, so there's our fur hiding there. So read it one more time.
Suffer, rain.
Yeah, what's our suffix that we know? Able, yeah. Suffer. And we usually get a little piece of that. We might say able, suffer, or able, sufferable. And notice also how I'm reaching out to pet Delta as well. If I am feeling a little more stress or a little more pressure in a session, having the therapy dog helps me as a clinician as well. And so here are some more just photographs of Delta being a supportive presence for the kids. She loves to just lay close to them while they're working. I especially love photos like this. I have quite a few of them of the kids finding some creative ways to be able to have their hands on her while they are working on something that's challenging for them. And one thing that you'll see fairly commonly in the therapy dog world, especially with volunteers that come into schools and libraries and things like that, is having the dog there as a non-judgmental listener for somebody who's practicing their reading skills. So here are some calming breath routines. I find that some kids do really well with this, having their hands moving on the dog. And so that's what this boy is going to demonstrate, just moving their hands down. I call that shoulders to tail, because that's where my dogs feel the most comfortable being petted. Some kids actually prefer to just have their hands still. I haven't found any particular pattern to be able to identify when, or to be able to predict when a kid is going to find one strategy more useful than the other. I just kind of experiment with both when I'm teaching these to kids. So again, this can be great if you see a child starting to have some escalating anxiety or at a transition before a activity that you know is going to be difficult, having them put their hands on the dog and do some deep breaths while petting. It gets that rhythm, it gets them slowed down. We also have research that shows that petting dogs helps just lower your heart rate, lower your blood pressure, increase some dopamine and oxytocin, things like that. So let's look how that looks in this short clip. So he was just taking some deep breaths in through the nose, out through the mouth while he was petting her. And just another photograph of him doing that here. This is some deep pressure input. I have a little more information on this in the another Therapy Dogs Explained video on my YouTube channel of different kind of presences, active presence, passive presence, and animal related engagement, if you're interested in more, as well as more information on my website. So deep pressure input relates to our sensory processing system and our sympathetic and parasympathetic nervous systems. And so by having that pressure on the receptors in your skin and your muscles, it can help stimulate that cascade of hormones that leads us to a calmer state, that rest and digest state, as opposed to getting more amped up and getting the adrenaline flowing in that fight, flight, freeze, or fawn mode. And so in this case, this is a larger boy. He's older. And so I have Delta on top of a mat so that she can have her whole weight on him. She is about 60 pounds. Not all kids want that much weight. And for obviously a smaller child, that would be an inappropriate amount of weight. But this particular child is a major sensory seeker. And so having a lot of pressure has been something that he really enjoys. I always give him a choice between these heavier squishes and what I call light squishes, where it's just the dog. And you'll see with the light squish in this picture here of my little Sky, she's just resting part of her body. That's really probably only a few pounds of pressure that she's actually putting on, as opposed to with the mat, and Delta's whole body up there. That's, quite a bit of pressure that she's able to apply. Another piece is that this is always done with the client's consent. They're asking for this. So I will start out by, if they haven't done this activity before, showing them pictures or videos of another child receiving deep pressure input, or we might model with a sibling or a caregiver that's willing to do that, and then having the child ask for it in whatever mode of communication that they are most comfortable with. And I also always make sure that they know that they can say that's enough or all done or something like that to have the dog get up. I've always got treats with me or close by so that I can lure the dog off immediately as soon as the child is feeling like they don't want this anymore. So this is something that's done totally voluntarily on everybody's part and is not forced upon anybody. But let's look at this young man with Delta and just watch his facial expressions and listen to what he has to say about Delta as he's receiving this deep pressure input. We're adding in that calming breath component as well.
Do you feel ready to finish our book?
Dana, I love her.
I love you, Dill.
So clearly that was something he was really enjoying. A couple more ways that the therapy dogs can really help me at work is just being a way of interrupting those patterns. So if I notice the child is starting to escalate or become dysregulated, I can kind of draw attention to the dog, take their mind off of the activity that's causing them frustration. So this could look as simple as if, the dog is sleeping in the room, I might say, oh, do you hear them snoring? Just to bring some humor, just to switch their attention to something else. And so in this video, you'll see this boy, he's actually under the table at the time that this video starts because he's having a very rough day. And I'm trying to get him back up just to end on a good note. We had a rather challenging session altogether, and see what happens when Delta comes over and I'm able to kind of draw his attention to Delta and ask him to do some things for Delta instead of just because I'm asking him to.
Try showing Delta some of our g sounds. Come on up, bud. Dakota, this is not a choice. It is time to sit in your chair.
No, I want to do my toilet then.
This is what we're doing right now.
He said, I don't want to do my appointment today. This was about 40 minutes into a session at this point. I was just trying to have us end on a decent note so that we had a positive memory to start from for the next session.
This is what we're doing right now.
I don't do
First, our picture word. I know you're not going to stay here forever. We're going to do our picture words, and then the ball pit, and then you get to go home. Remember our schedule? But we have our picture words. We are gonna... Oh, you're ready for the picture words. Let's turn and tell Delta. Yeah. Okay. So, you sorry?
Yeah, he's saying he's sorry because he had been shrieking, and one of the things I had said is, "Oh, that really hurts Delta's ears. Let's try to use a quieter voice." You'll also notice in these first few productions, he does not get that back g sound. I'm just trying to get some behavioral momentum and get him participating. So I'm not giving him feedback on his production at that point. I'm just trying to establish the activity of saying the words.
Were you sorry you were hurting her ears? Yeah. She understands. Can you show her in a calm voice how we do our guess? Remember, she likes it when we pet her. Can you show her how you say guess with that back sound? Let's try it 3 times slow. Guess. Nice. One more. Yes. We did our guess word. Let's try goal. That's the other word you can't. Let's try goal. We'll do our slow motion. Goal. Nice one. Yes. Look at her ears. She's listening to you. She says that's so good, Dakota. We have another word. Game. Yeah, 3 times with our slow motion. Oh, she wants to hear it again. Game. One more. Nice job. Guess what? We finished our picture words. Where's our eraser? You know what that means. Can you use your calm to tell Delta? Yeah, we put our hands on Delta and do our slow breath. Can you use your calm voice to tell Delta what's next on our schedule?
A ball pit.
Yeah, tell Delta. Hey, Delta.
A ball pit.
That was such a calm voice. Let's go to the ball pit.
So you can see how having Delta's presence there just kind of distracted him away from the fact that he was, actually finally doing something I had asked him to do. And then another piece of having the therapy dogs at work is really that clinician mindfulness too. This has really helped take a lot of that burnout and that fatigue away from work that we do on a day-to-day basis for me. When I do have a difficult session, I've always got a dog doing something silly or an excuse to, go out and take a quick walk around the building before the next client comes in. And it just brings a lot of joy to the day and has really renewed my passion for this work of speech therapy that I do. It's been just a great joy having the therapy dogs at work with me. So if that's something that you think might be a good fit for your clients and you're interested in learning more, I have a lot of information on the website here, www.speechdogs.com. I do have this book, Pause for Progress, Integrating Animal-Assisted Interventions into Your Speech Language Pathology Practice, and that's available through Amazon or Asha Press, who is the publisher. If you're ready to take a deep dive, I do have the Talk to the Paw, Foundations for Therapy Animal Inclusion in a Professional Setting online course. It's more than 7 hours long. It's got lots of bonuses and links to other resources as well. And so that can be a great fit for you kind of regardless of your profession. The Pause for Progress book is a little more speech therapy focused, although a lot of it would apply to other fields. Talk to the Paw is intended to be a little bit more all-inclusive. On the website, I also have a lot of other resources, including a free roadmap to getting started with a therapy dog in a professional setting, as well as frequently asked questions. I love to write about this topic, so I have a lot of different articles on a bunch of different topics. However, if there's something that you are interested in or curious about that you don't see listed on the website, feel free to contact me. There is a contact form on the site as well. I'd love to hear what your questions and concerns are. Okay, thanks so much for watching.